Mailer from Healthcare IT News. We're here today with Kourtney Govro, CEO of Sphere3. Thank you for being with us today, Kourtney.
Thank you very much for having us.
So tell me, can you please give us a brief description of Sphere3 and Aperum?
Sphere3 is an analytics software that looks at the medical device alarm and alerts and helps hospitals improve HCAHPS questions 4, 9, and 13 and helps solve for things like alarm fatigue and other issues that are challenging the hospital. We mine the data out and put it in a dashboard and provide it back, reveal it back to the hospital.
Great. Can you talk about the emerging market for patient satisfaction software?
You know, I really believe that, the patient experience management and how we're going to move from just looking at how the patient is engaged on an active basis by the clinicians, that's going to become a much bigger part of the healthcare market. I think that our software, along with others that'll surely come out in the coming years, are going to address some of these HCAHPS questions because the hospitals are really challenged with transparency and how do we deliver the best level of care.
Right. What types of data does Aperum collect? How does it collect this data? What does the data reveal about a hospital's commitment to patient satisfaction?
Aperum looks a lot at nurse call data, so when you press the button, how long did it take the nurse to respond to you, to come in the room, what types of things are you asking for, are you in pain, do you need to go to the bathroom, and does that indicate whether or not you're going to be a fall risk or a patient that has a poor response time, are they going to have bad patient satisfaction scores. We also cross-reference all of that information with other medical device alarm and alerts such as telemetry, physiological alarms, and we can do a lot of data mining that helps reveal whether or not this patient is going to get up out of the bed and fall and really cause a problem for the hospital.
So Kourtney, how can hospitals do a better job cultivating a culture of caring staff?
You know, for me, if I was a caregiver on the floor, I'd want to know my ability to respond to the patient needs. I'd want to see that data actively and be able to engage the patient and do improvement in a self-improvement process. A lot of it is they don't know what they don't know. So a caregiver doesn't know that it's taking them 2 minutes to respond. And then they can't correlate that back. Is it a staffing problem? Do we not have enough nurses on the floor to engage the need? We kind of look at that as a demand-based acuity model. So if my patients are extremely needy, do I have the right care grouping to take care of them? And I think that's just going to grow, as transparency pushes more data out into the market.
So Kourtney, can we see a quick demo?
That'd be great.
Sure.
So in Aperum, this is the live view of Aperum. The patient need indicator heat map is our way of looking at demand-based acuity modeling. So you can actively see which patients are the most needy during the shift based on the amount of times they're pressing their call button, the amount of different alarms they're generating, how much need are they actually demanding during their shift. Blue is medium, green is light, white means there's not a patient in the room. So when you're doing your next shift assignments, you can quickly and easily look at the screen and see what patients you're grouping together for the caregivers. We run indicares, which are indications of care. These are just simple metrics that a unit can use to see, do I have enough staff available to meet the current demand of the patients? Are we going past our set thresholds? And what's our actual verbal interaction time? So after the patient pressed the button, how many seconds are they waiting to be spoken to on average? You can see it in an aggregate view, so all of the activity and alarm data. And then we actually have a detail view, so every single patient activity can be seen per room. So the little blue star, for example, is a bed exit alarm. We can see when the patient pressed their button to get help, and then if they got up out of their bed without assistance and caused an alarm, which potentially could cause a fall. All of the information can be trended in our Trend It module, and you can trend the indicator by unit, patient room, or by caregiver. And then you can set your period of time and just click trend. Then all the data is displayed in the shifts. So you have day shift, night shift, and then the SKUs, which are shift change A and shift change P. Rolling over any one of those, you can see the detail of the average verbal response. This is the one we've selected. Or you can drop down into a data table and get deeper into the data. Our newest module is RCA Snapshot. It's the root cause analysis tool that allows us to enter the date, or the unit, the room, and the date and time of the fall. Click Update. And then you have a very quick picture of all the alarm activity that was occurring during the time of a patient fall. So for example, when we revealed this information to a CNO, she said we should have had a sitter. We should have had someone in the patient's room because it was obvious that they were getting up out of bed without requesting help, or interacting with their nurse. And you can see the fall occurred right here. So this is the individual patient room, all of their metrics. This is what was going on in the unit for a 24-hour period of time. And then this is the detailed view of the caregivers that were assigned to this patient during the time of the fall. So you can see when the bed exit occurred and when the fall is documented. Very simply, if you want to see a shorter time frame, you can just click and drag and slide in. And you can see a different view, a little bit more detailed of when the fall occurred and what activity was going on the unit and alarms around the patient. And that's Aperum, and it can run on the dashboard, the desktop, or it can actually run on the iPad as well, or an iPhone.
Great. Well, thank you for being with us today, Kourtney.
Thank you.
This is Kelly Miller for Healthcare IT News, coming to you live from the HIMSS show floor.